Okay, so hello and welcome to Itentive Healthcare Solutions webinar. We're excited to share our NextGen add-on solution, CharCard, with you today. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Itentive. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. Next, for those of you who aren't familiar with Itentive, I wanted to share a bit of who we are with you. We specialize specifically in NextGen healthcare. We're good at getting data into, out of, around, and through NextGen. Basically, our goal in life is to make delighted clients by helping them get the absolute most out of their NextGen software investment. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. We also have two NextGen add-on productivity solutions, CharCard and RefundManager. Next, I wanted to mention some upcoming webinars. The first one is going to be on February 1st and will be on what to expect when you're testing, a survival guide to meaningful use to attestation. In this webinar, we're going to provide you with detailed instructions on how to attest and what you can expect while attesting. Then on March 15th, we're going to present today's electronic data interchange, so much more than claims, where we're going to explore today's EDI capabilities, including appointment reminders, statements, collection, patient satisfaction surveys, real-time scheduling, patient outreach, population health integration, and so much more. So we hope to see you there for those. We're going to send an email out about a week before, or you can head to our website now on the Events and Education page to register for them now. Okay, so back to Refund Manager. At the end of this presentation, we're going to open the floor up to questions from you. We're going to answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Tom Seco is Itentive's Business Development Manager. Joe Schultz is Director of Product Solutions at Itentive. Tom, I'm going to go ahead and pass the webinar off to you. Please feel free to get started when you're ready.
Okay, thank you very much, Chelsea.
Thank you,
Thank you, everyone, for coming to the webinar to learn about Refund Manager and streamlining your refunds and patient credits. It's an agenda that we're going to cover today. You'll find out during the webinar what is Refund Manager. You'll find out why practices buy Refund Manager. We'll show you how it works through the demonstration. We'll talk about the various versions of Refund Manager, and then at the end give you a brief overview of who Itentive is, and then answer any questions that you have. The purpose of Refund Manager is to make the job easier. And we do that through streamlining and automating your credit balance handling and refund check processing that occurs within your organization. We're able to do that because we can integrate with your financial system, your accounting system, and through that integration we are able to eliminate data entry along the way. We integrate with various accounting packages, QuickBooks Pro, QuickBooks Enterprise, Peachtree, ACPAC, various ones like that. I have a direct interface, and other applications we use a CSV file to integrate with as well. The overall goal of Refund Manager is to increase productivity. When we went back and talked to our clients that use Refund Manager, they told us that they have been able to reallocate resources to other areas of billing accounts receivable, and they've been able to spend less time sending money out of the organization and more time spending into bringing money into the organization. When we also talked to our clients that use Refund Manager, they came back with a series of comments and statements, and here's a few of the snippets from those comments and statements. I won't go into each one of them, but I will point your attention to a couple of them. The first one is the first bullet that says reduced from days down to hours now. That shows that Refund Manager is a productivity improvement tool. And then the fourth bullet says pays for itself in time savings alone. That shows that there is return on investment with regard to using Refund Manager. There are some risks that are associated with carrying credit balances in your system. Medicare has some clauses with regards to penalties. Insurance contracts usually have clauses, state laws with regards to carrying credit balances, misstated profits, and fraud. With regards to Medicare, there are clauses in Medicare that state that if you don't get credit balances back to them in a timely manner, that they can start to incur some fines and suspension of Medicare payments. Third-party payers usually have clauses in their contracts with regards to getting credits back to them in a timely manner as well. There are state laws regarding credit balances and carrying them for a period of time. Each state is different, so look in your respective state to see what the laws are with regards to that. There are some laws, as seen up here on the slide, with regards to California, for one example, require you to pay interest after 60 days following an overpayment. And then other states have laws with regards to reporting back after a period of time to the state that the credit goes as unclaimed property. There are some organizations that require or that think that credit balances, if they go unclaimed, can be a quote-unquote a profit center for them, meaning that the money for the credit goes back to the organization. And just as we talked about with regards to Medicare, the insurance contracts, and state laws, that is not the case. There is a potential of fraud, and the reason for that is, we talk to organizations all the time that carry 1,000, 2,000, 3,000, 5,000, 10,000 instances of credit balances in their system. And when you're getting into that type of number, there is a possibility for unethical behavior to occur. So with Refund Manager, by managing your credit balances in a proactive manner and on a regular basis, you can control any of these risks from occurring. These next few slides that I'm going to go into are going to talk about the refund, credit balance handling refund process that typically occurs within an organization. This particular slide, when you have a credit balance, you are either going to handle that credit balance in a reactive manner or a proactive manner. In a reactive manner, I mean somebody calling up, a patient calling up and saying, I have a credit balance and I would like to have a refund check issued to me. In a proactive manner, you print off a report and you go through that report and process your credit balances that way. In either case, whether it's a proactive manner or a reactive manner, you're going to go through a series of steps to identify what that credit balance is and what makes up that credit balance. You're going to look at the encounter details, you're going to look at the transaction details, you're going to look at the account details, and then you're going to determine what to do with that credit balance. Now, you may issue a refund for that credit balance, or maybe there's an encounter that has an open balance on it, and you want to apply that credit balance over to that encounter. In either case, like I said, you're going to go through this series of steps. Once you complete that process, you're going to move that information over to your accounting system. And how that information gets over to accounting occurs in many different ways in many different organizations. Some organizations put it on a spreadsheet and email it over to the accounting department. Other organizations print off pieces of paper and drop it on somebody's desk. Other organizations just verbally tell somebody how the credit is due to this particular patient. So how it gets over there varies from organization to organization, but once it gets there, what happens in accounting is they have to enter that information, that payee information, into their accounting system in order to print the refund check. So they have to go through a series of steps of entering in the patient name, patient address, or the recipient address, the amount of the refund, information like that. And once they get through that process, then they can print the checks and mail them out. Some organizations then manually enter the check information back into NextGen. So they have to go through a series of steps within NextGen in order to get the check information as far as check number, check date, check amount over into NextGen. So another series of steps that they have to go through. So you see in this process that it's very step intensive and increases in complexity based on the number of credits that you're processing. With Refund Manager, what we did is we looked at the process overall from start to finish, and we looked for ways where we could streamline and automate using technology. So we could eliminate data entry where we could, and we found an area to do that within the accounting area and moving the check information from the refund check information from the search of the credits over into accounting, and then eliminated the data entry on the automation piece of bringing the check information back over into NextGen. The streamlining occurs on the front end with the billing individuals in the way that we have created filters and search mechanisms. We make it much easier for the billers to find the credit balances on patient accounts. And then in the way that we present the information to them on the screen, it makes it much easier for them to decide what to do with that credit balance, whether to issue a refund or to distribute that credit to an accountant that has an open balance on it, or maybe they just don't have a lot of time at this point to do a lot of research, so they'll task it out for further research to come back and work on later. So the streamlining on the front end, and then automation on the back end with moving the refund check information over to the accounting system. And what happens there is the accountants just have to make sure that there's basically paper in the printer, check paper in the printer, and that the checks are printing out okay. And then the automation on the back end with bringing the check information back over into NextGen. And you'll see how this works through the demonstration. There are 3 modules that make up Refund Manager, and you'll see these modules in the demonstration as well. The Credit Scout module is the module that's going to be used by the billing side to find the credit balances on patient accounts, and then decide what to do with that credit balance, whether to issue a refund or distribute that credit balance to an accountant that has a balance on it, or task it out for further research. The Batch Detective module is the module that's going to be used by accounting to bring the refund check information over to the accounting system. And then the Importer module is the last module, and that is the module that brings the check information back over into NextGen and updates the patient account with the check information as far as check number, check date, check amount. So you'll see these 3 modules in the demonstration as well. The benefits of Refund Manager, as I mentioned earlier, reducing time for issuing refunds, being able to apply the credit balances to other encounters that in the practice, being able to do the tasking out for further research. We integrate with many different accounting applications in order to eliminate data entry and errors that occur with data entry. You're going to see in the demonstration how Refund Manager documents itself along the way with the activity that's occurring. So you will know at any particular step along the way where you're at. And then being able to move that check information back over into NextGen. And the value of this is when a patient calls up and says, you know, I had a credit on my account, I asked for a refund check to be issued to me, and wanted to know, I haven't seen it yet, so wanted to know where it's at. The calls can go to the front desk, and they can look up that patient account and say, oh yes, that check was sent on this date to this address, so that the calls don't have to go to the back office. We updated Refund Manager in January with our latest release, and we have made Refund Manager MultiPractice Aware. so that if you have multiple practices set up in NextGen and a patient is seen in multiple practices, you can see the financial account for that guarantor account, and being able to move credit balances from apply a credit balance in one practice to an account that has its own balance in the other practice if that's the case. We do have a workflow capability we built into RefundManager as well, which allows for an individual or group of individuals to be people who request refunds, and then have an individual or group of individuals that can be designated as the processor or approver of a refund. So you can split it up that way. So now what I'm going to do, I'm going to turn it over to Joe Schultz, and he's going to go through the demonstration of RefundManager for you.
Thank you, Tom, and thank you everyone for joining us. Right now on your screen you should see NextGen up there, kind of the big gray area, and then the toolbar at the top. Please indicate via the questions or chat box if you're having any trouble seeing this as we transition machines. What I want to do is take about 20 minutes and bring you through the RefundManager process as it works using the application itself. And this way you'll get a great feel for all the productivity gains Tom was just talking about by being able to easily identify credit balances, take those credit balances and distribute them out, or refund them, or put them into the work log for additional research later. After that, we'll go through and put the information into the accounting system without having to do all kinds of data entry. For the environment today, we're using QuickBooks for the accounting system, but as Tom mentioned, there are nearly a dozen of them that we support today, and then a number more we can support through customization. And then as the last step, once we have the data in the accounting system, we'll print the checks and with several mouse clicks bring all the check information back into NextGen to close the loop. When we created RefundManager originally back in 2005, our goals were to have it be as integrated as possible with NextGen Practice Management, to work like NextGen Practice Management so that people who knew how to use PM could easily make the transition to RefundManager, and also to make it be aware of who you are and what environment you're in NextGen. So in our case today, we're in our demo database, so when we launch RefundManager, it's going to get from NextGen who you are, what practice you're in, and it's going to go out and look at what environment your NextGen is pointed to. So if you're in prod, it'll work in prod. If you're in demo, it'll work in demo. If you're in test, it'll work in test. So when we launch it, this prevents us having to have a whole separate set of credentials, a whole other set DB, all the things like that. We want it to behave as if it's part of NextGen. And you'll see how it navigates and how similar that is to NextGen as we go through the process here. So as Tom mentioned, the three modules, we're going to start out here in the Credit Scout. We're going to work through some credit balances. We're going to get those transactions into NextGen. We're going to go back into NextGen, post them, show you around what's been done. Once we have posted batches in NextGen with refunds in them that we want to get over to the accounting system, we'll go ahead and use the batch detective to export those into the accounting system very quickly. And when we're done printing checks, we'll import the check information back into RefundManager and NextGen, again with several mouse clicks. A lot of the productivity comes from using the computer to automate a lot of stuff that's being done manually in the practice, both on the NextGen side and on the accounting side. So let's jump into the Credit Scout and look for credits that we want to take some action on. Now if you look at the screen, it's very similar to the way a lot of the NextGen search screens are laid out, with our search criteria at the top and our results come up at the bottom. The search criteria items along the top are all things that have been added over the years based on suggestions of people using RefundManager. So as Tom mentioned, if you're being reactive and just trying to get refunds issued or money moved around for a particular patient or a particular account, there's fields on here to enter in the names or account and encounter numbers. If you're working through catching up your credit balances, you can cut down, rather than searching through your entire database and getting thousands of results you're never going to work through that day. We give you the ability to break it up into date ranges and just look through a certain range of dates based on data service for encounters with credit balances. We have some filtering in here that, as part of your training, will go into more detail. The filtering allows you to find the best candidates for refunds at various levels, so kind of good, better, best type levels for refunds, looking at the credits. It also allows you to look specifically for distributions, which is when you have a credit on one encounter or charge and you want to move that money to another encounter or charge. So those things are in there, again, all to provide more productivity to you. We have some clients who are looking for insurance refunds versus patient refunds some days, so we give you the ability to search on that. Refund Manager is MultiPractice Aware, so for those of you who have a CBO that manage several practices, or maybe you have a practice in a surgery center and you need to move money between them, you'll be able to see the practices that your user ID has access to through NextGen Security and pick from those practices. Okay, other great items in here for helping to search: location. Again, if you have people out at each location working their own refunds, you can use that. Some cases we have analysts at the central billing office that work basically credits for a particular provider. If you're trying to clean up and look for credits belonging to a particular department, financial class, that's all in here too. So we give you a lot of different ways to search for credit balances. I'm going to run kind of a wide open search today, which you wouldn't normally do, but for demo purposes, there are several test accounts that we've created here that I want to bring up to give you a really good idea how Refund Manager works. So when I click Find, it's brought up the results on the lower half of the screen, and what it's showing us is just a brief summary of the guarantor and the credit amount for the patient and payer, and then how many practices it found credits in. So yeah, that's good, but we understand you need more information to make the call on what you're going to do with these credit balances. So let me scroll down here to a couple of accounts that we've set up and that we like to demo with, and I'll take you through those and show you in a little more detail how Refund Manager is used. I'm going to start with our test patient, Marion Kelly here, and like I said, this is the guarantor level. If you want to see more detail, you can click these plus signs to the left and expand it out. So we can see under the guarantor, Marion Kelly, the practice account that the credits are in. We can see who's going to get the refund, and this is determined by what bucket the credit is in NextGen. Is it in the patient bucket or COB 1, 2, or 3? And then we can see the encounters that each have a credit balance. In this case, we have 6 different encounters that are going to have credit balances on them. In fact, if we want, we can even go down to the charge level and pick particular charges that we do and don't want to refund. So we give you kind of those 5 levels, all the way up from the guarantor down to the charge for you to look at and see where the credits are. Now additionally, you may need to know, wow, are these real credits or are these credits that were created by just people going crazy with adjustments? Okay, maybe things were adjusted off that shouldn't have been, resulting in an actual payment now showing as a credit. So we give you screens in Refund Manager that mimic the financial summary and account summary screens in NextGen. The account summary is a good tool to use because it shows you all of the transactions for your encounters so that you can look at it and decide what you want to do. All right, so I've sorted it by encounter here. So we can see, for each transaction and charge on each encounter, we can expand it just like we do in NextGen and see more detail and kind of get an idea, what items are payments, what items are write-offs and adjustments, and figure out what we're going to do with this particular credit. Additionally, part of the reason we give you the financial summary is so you can validate if the credit should belong to a particular bucket or not. Right, it's in COB1, or should it really be the patient's? And this gives you kind of a summary, again, similar to the financial tab view on the chart in NextGen. In fact, this one is a little smarter in that if the guarantor is in multiple practices and has dependents, it'll show you all of that on this particular form here. But if you think about your financial summary tab in NextGen, you'll remember that it breaks everything down by bucket, and you can see the balances that are out there. So we give you those tools within Refund Manager to help you decide what you're going to do with those credits. Now, if you run into something really messy that, gosh, you know what, I've got a flow going right now, it's going to take me 30 minutes to go figure this particular encounter out, you have a couple options. You can either do nothing, or you can choose to task it into the work log, and I'll pick a couple of those later on. Okay, so that's your first option that you can choose to do with credit balances, is task it into the work log. The other option we could do is if we were searching for distributions where we have a credit in one spot and a debit in another spot, we could pick the D column here, checkbox, the distributions, and pick that to distribute. In this case, for our demonstration, we're going to go ahead and refund these to our guarantor. So all we have to do to get Refund Manager to create all those transactions for those 6 encounters in a few moments is click the refund checkbox, and then when we tell it to go do its processing, it'll do all that transaction work on your behalf in NextGen. Again, that's part of the streamlining and automation that Refund Manager gives you to increase your productivity. So let me take a look at another one that has not only patient balances, but also credits due for the insurances too. So we have this other test patient we've set up, Mildred Key, and we can see in the columns that we have some credits here in the patient column and some credits here in the insurance column. So we can click the plus sign and expand this out. We're going to move this up closer to the top so it's a little clearer what we're looking at. Also, one of the things we find is that clients, after they use Refund Manager for a bit, really quickly learn what these columns are. So you can turn off the column headers, which gives you a much cleaner view of the data. So we can take any one of these recipients of the refund, kind of this middle level here, this third level down. Remember, we had guarantor, then the practice account, then who's getting the refund, and then underneath these we have the encounter and the charge with the credit. Okay, so in this case we have money due to 3 different entities across various encounters. So we have money going to the guarantor, we have money going to Medicare, money going to United Healthcare. Well, if we want to go ahead and refund one of those, let's say we just want to do Medicare, we can pick that checkbox. If we want to refund all of them, we pick a higher level checkbox and it checks everything underneath. Refund Manager also supports having alternate addresses for refunds. We have an address book built into Refund Manager where you can store multiple addresses for a payer. We also support the refund address capability that's been in NextGen for a couple of the past releases, where you can define a refund address at the transaction level if you're manually creating the transactions, or at the payer level when you're setting up the payer. So we give you all those different options for what addresses you want to use. The big advantage of the Refund Manager one is we can store several. So if you have like a generic commercial payer and you're always having to retype in the address information, in Refund Manager, you can set all those up and tie it to that generic payer, including the payee name, and have that available for you when you want to create the refund. But in this case, what we're going to end up with is a multitude of transactions that are going to be created. So if I expand each of these, we can see there's multiple encounters for each of the payers, and then the patient has a single encounter underneath it. So all that work, again, is going to get done for you when we tell it to go ahead and process those transactions. So that's how easy it is to get refund transactions in the NextGen. It goes by the balances that are in there in the various buckets and creates those transactions, so you're not having to bounce around the transaction screen and the different encounters in NextGen to create all that. Now, I also mentioned that Refund Manager does distributions, and again, the distribution is moving the money around. So Refund Manager supports distributions within a practice or between practices. Again, perfect case we run into often. If you have a practice in a surgery center and maybe you took a deposit in the practice that later you want to move to the surgery center, it can write it off in the practice and move that to the surgery center. But let me show you a simple case first on one of the patients that we have set up here in our test environment. So I'm going to pick this one down here, Catherine. I'm going to expand it out. And we'll see down here at the charge and encounter level, we have a credit of $220, but when we roll it up to the account, there's only a credit of $185. So that means somewhere money is owed, about $34.15. So if we want to go ahead and take part of that credit and distribute it to a spot where money is owed, we simply go ahead and pick the checkbox here for the distribution. If we want to see what it's going to do automatically, we can jump in and do a distribution preview, and it'll come up with a screen with a set of transactions. In this case, there's only one. Everything to the left of the cursor is where the money's coming from. So here's the practice, the person, the encounter, the charge, the amount, the current balance, and everything over to the right of the cursor here is where the money's going. It's staying in the same practice, same person. It could go to a dependent. In this case, we're just using the same person, and so on. So it's going to put it over on this other charge. So it can move money between encounters or even between charges within the same encounter if something got applied wrong, or maybe the other charge wasn't there when the payment got made, so they put it all on the first charge, and now there's a credit on the first charge but not, on the newer charge, so you need to move the money there. Refund Manager can do that for you. Now, if we run into a case where we have a lot of activity going on and we want to do a distribution and we want to control how that distribution is going to be done, we have a screen for manual distribution matching. So if I go up here to Dennis Kramer, we can see that Refund Manager's found credits in 3 of our test practices here. So we can right mouse and we can pick distribution matching. Okay, and on the left side we're going to have all of our credits, and on the right side we have all of our debits. So we can go ahead and work within the same practice if we want. So we just pick one on the left, one on the right, we add match, and that's the work it's going to do if we think of that other screen we were just looking at. So when it updates the balances as we progress through these. Maybe one of them is a deposit against a surgery. So we're going to come over here and put some money against the surgery center. So you have this ability to control at a transaction by transaction level how you want to distribute the money. And again, Refund Manager is going to do all the work of creating the transactions in NextGen to implement the items you've clicked on. Okay, and we can either keep going through this until we're satisfied. Again, this is a rather complex example. Okay, and then when we got everything where we want it or we run out of money, let me do one more of these. Let's do this one, and we'll zero out all the money that's owed. Okay, so now we have no more money that's owed, and we still have some credit left, which on a future run through these, we'd go ahead and probably do a refund for those, but in this case, we're going to do our distribution and see all this messy work down here, all these transactions that need to be created. Again, Refund Manager is going to do that for us. Okay, and as I mentioned earlier, if we found ones that, gosh, they were really messed up and we wanted to come back later, we just pick the task checkbox and it'll go ahead and enter that one in the work log. For the purpose of our demonstration today, I'm going to pick a couple others just to get some more refund data out. We support employers as guarantors too, and this line here we can see it's the company, and then the patient is the dependent on that guarantor. So after you've gone through and you've picked how you want to process particular lines in the results, to get the work done for you, you right mouse and you say process selected items. It'll come up with a screen summarizing the work it's going to do, the number of charges it's going to touch. If you have access to multiple practices, it'll show you those. If you're just in one practice, that's fine too. For our tasks that we're going to create, well, we can go ahead and pick the task type that we're going to use for those. For our refunds, we have our transaction codes here. These are your NextGen transaction codes. So if you're thinking about when you're doing a refund transaction, picking those codes, these are the ones that will be used for patients and insurances. And then for our distributions, when we move that money around, we have three options. The first one is within the practice. If we're moving money, here's the code to use. And the next two have to do with getting the money out of the practice and putting the money in the other practice. So in this case, we're going to use a refund code, and the accounting system is going to cut a check to the other practice. And then in the other practice, we're going to go ahead and do a cash payment code, and that's going to put a payment into the other practice when it moves it. So the top one is within the practice, and the next two are write it off and put the money in the new practice. Also, we have the ability to use financial class specific transaction codes. So we have some patients who have a transaction code basically for every financial class. You can set up that mapping in RefundManager, and it'll try and use those, and if it can't use those, it'll use this one up here. All right, so then when we're ready to have RefundManager do all this work, we click Start. It's going to go out there and create 16 refund transactions for us. So instead of us spending the next 30 minutes typing, RefundManager is just going to take a couple minutes and create all these transactions for us, and we'll see that when we post the batch. For that one, we chose the task. There were 2 encounters underneath it, so it's going to create a task for each encounter because we selected to do the tasks by encounters. And last, the distributions. So I picked a mix of different things here, and again, we'll see it'll come up and just give us a brief summary of everything that's going to happen, just so we can have a last look at it before it moves all the money around. And then, yes, we'd like to go ahead and do all this work. And RefundManager is going to go out there, and in this case, it's going to do the moves between charges and encounters within a practice, and also the write-offs and the cash payments between practices. So when we have a last option where, you know, we can go ahead and review the work that was done. If you want to go ahead and save this so you can compare it later on, you can export it out to an Excel file so you have record of the distributions that you did. Additionally, these things will be commented in NextGen. So now RefundManager in several minutes did an incredible amount of work for us. It created some tasks. It created 16 refund transactions. It did a whole bunch of distributions on charges between practices. So what does that look like in NextGen? So let's go ahead and close this screen where we've been working through our credits in NextGen. And now go ahead and pull up our batch. I'm going to go ahead and just balance this batch out. So all that work was done for us on this ledger that we're seeing back here. So you don't have to type any of that. Okay, RefundManager will do that for you using the data that's available in NextGen. So we'll get this balanced and we'll get it posted. And then we'll jump in at the account level and look at the distributions, and then we'll jump in at the chart/encounter level and look at the refunds. Okay, this is the lengthy part of the demonstration because we're streamlining, we're taking your decisions and implementing them via those checkboxes. So this is all the work that was just done on your behalf. So let's go into the account for Dennis Kramer here, where we had a whole bunch of distributions. And the account summary. So we can see all these transactions that were created for us. Okay, and these ones were specific to encounters, and then these other ones with no encounter numbers are ones that were moves between various charges within the practice. Okay, let's also take a look at refunds because that's what we really want to follow through the rest of the system. So I'm going to go ahead and pick one of these encounters. And here's the transaction that was just created, and right now in the tracking description it has the batch that it was part of. RefundManager also created for you a note with a little more information about who did it and when and where it's going. All right, so on the NextGen side, hopefully you agree that that was a huge time savings being able to get all those transactions in. On the accounting side, it's equally as beneficial. So let's say now we got our batches out there in NextGen and we want to get them over to the accounting system. We have some clients today where it's all keyed in. Some clients produce files and have to massage those and get them in. Well, with Refund Manager, we're going to go ahead and say find our batches that contain one or more refund transactions. I'm going to pick the one we just used here. And we're going to right mouse and start the export process. Now for many big accounting systems, they do a really good job at consolidating checks to the same payer. QuickBooks, not so much. So we have a screen in here that we use with QuickBooks and sometimes with Sage Peachtree that does the consolidation for us. So basically it's showing us, like for here, I don't know if you remember a few minutes ago we were looking at Mary and Kelly as one of our test patients that had the 6 encounters. So what it's telling us is for Mary and Kelly, it's going to issue 1 check for those 6 encounters. Okay, and it did the same thing for John Katz, which is one of the ones I picked at the end. From this screen we can consolidate and deconsolidate if we want. So we can pick several of these, and then it'll be smart enough where if we right mouse and say consolidate, if they have matching demographics that they're going to, it'll go ahead and just put a single check. Now in other accounting systems you just use the 1 check per vendor, and when Refund Manager sends over the information for the vendor and the payments, it's smart enough to roll them up. I'm going to go ahead and continue the export process. Now, for those on the accounting side, this is the part where you'd sit down with your Excel spreadsheet and start keying in demographics and payments and all that stuff. And, probably for this volume, it still may be 30 minutes worth of work, but if you have several hundred refunds you're doing, it may be an all-day thing. So QuickBooks is a direct interface for us, so it's going to go ahead and open up a connection into QuickBooks and put that information in there. For some of the other systems, we have a specific file that system knows how to import, and we'll create that file, and then you click a couple buttons in the other system and it brings it in. So we started out with 19 refunds, and we consolidated them down into 8 checks that went to Refund Manager. So I'm going to go ahead and jump over into QuickBooks, and we can see we now have these checks in here created for us, the demographic and the payment. For the consolidated ones, we went ahead and sent the detail to. Okay, so now on the accounting side, you have your checks in there. You didn't have to do all that nasty data entry where you might have some errors or some decimals be off, things like that. So that got in there and made your life a whole lot easier. So now really you just load up your check stock, get your check batch ready, and print your checks. So all our checks are queued up. I'm going to go ahead and just dump them to a file here right now, but normally you'd print them on check stock. But what I want to accomplish here, I'm going to tell it all the checks printed, okay. What I want to accomplish is when the check's printed, now they have check numbers in them. So we have the check number, check date, check amount. Let's get that information back into NextGen. Doing that through Refund Manager is really simple and really quick. So I'm going to go into my import screen. I'm going to click Find, and here's the one that we just did. I'm going to right mouse, and again, instead of us having to send reports back and forth and key things into NextGen, it's going to bring the information and apply it to those 19 refund transactions so that you have in NextGen. Let me refresh the screen. The check number, check date, and check amount. All right, just through several mouse clicks. So this is why clients love using Refund Manager. It really speeds things up. It saves you having to do kind of this mundane data entry work on both the NextGen side and the Refund Manager side. It's basically your assistant that goes out and does the work for you. What I'd like to do right now is turn it back over to Tom, who has a few more slides he wants to cover, and I think after we cover those, we'll do some Q&A.
Okay, great. Thank you, Joe. Okay, so you saw the credit scout, you saw the batch detective, and you saw the importer module. People generally ask us what it takes to implement Refund Manager, and it takes about 90 minutes to install the software in your environment. We also have created 4 training videos that are about 10 to 11 minutes in length each, and we ask you to view those training videos. And then we have a user guide that we ask you to go through as well. Once you get through the training videos and the user guide, what we'll do is schedule a question and answer call with one of our Refund Manager specialists, and they'll answer any questions that you have with regards to the process. Once we have gone through the process, we'll walk through the first batch of credits with you in your test environment. And once you feel comfortable in your test environment, we've gone through the training, then what we'll do is point you over to your production environment, and we'll be on the phone with you as well during that process, walking you through the first few batches on the credits there as well. There's 3 versions of Refund Manager: a standard edition, a professional edition, and an enterprise edition. And you'll see the standard edition works with QuickBooks Pro and Peachtree. The professional edition works with the QuickBooks Enterprise, Great Plains, ACPAC, any CSV or XML file interfaces, and the enterprise edition is for practices that have multiple practices set up or multiple interfaces set up. Just a couple more slides to go through, and then we'll turn it over to question and answers. Itentive was founded in 2003, and our mission is to create additional value for your NextGen investment. We have 19 plus years of experience with NextGen, and we have 70 employees coast to coast, much of which are consultants that move from practice to practice, health center to health center, work with the organizations to improve business process, workflows, and help you get the most out of your NextGen environment. During these 19 years that we have of experience with NextGen, and since we started with in 2003, we've worked with over 350, 400 clients that use NextGen, and during this time frame, we've become a NextGen strategic partner. We do implementations of NextGen. We have process improvements and workflow improvements that our consultants provide as well. We have a team of developers that can provide template enhancements. We do upgrades to NextGen and provide support for NextGen as well. We have a group of IT folks that can provide IT managed services, meaning that we can support your desktops, your laptops, your printers, your network infrastructure. And we also have our own data centers, so we can do hosting of your environment in our own data center. We have a group of developers that develop productivity tools, of which Refund Manager is one. Another productivity tool that we have is called CharCard, which is a business continuity solution. Basically what that does is each night it goes out to the appointment book listing and looks at all the patients that are scheduled to come into each of your locations. It then pulls their chart information, puts it into a file, and then sends that chart information to each location to a designated PC, so that it is there locally in case that location loses access to NextGen. If that does occur, the providers and staff can go to that PC and get the chart information from that PC, and they can continue to see their patients with minimal disruption. And then we have a derivative of that called CharCard Archiver, which is for long-term storage of patient chart information. And now what we'll do is open it up for questions, and we'll turn it back over to Chelsea.
Great. Thank you so much, guys. I appreciate it. I know that was a lot of information. And again, questions can be entered in the questions box of the webinar control panel. And if you think of them later, you can always feel free to reach out to either Tom or Joe, and they'd be happy to help you with those as well. Okay, so Joe, I think this is a question for you. Somebody's wanting to know if Itentive integrates in with Meditech 6.1. Specifically, they use NextGen, but the refunds are processed in Meditech. Would we be able to upload and download refunds to Meditech?
Thank you, and thank you for that question. That's, one of the ones we get often is people with various accounting systems and wondering how we integrate with them. For Meditech, we do have a CSV file that we can export out that Meditech knows how to import in. We have a couple clients who are using Meditech and use that file format to get the refund information out. And again, this includes the demographic and the payment itself. So the answer is yes, we do support Meditech.
Perfect. Thank you, Joe. Next question, probably be a good one for Tom. What does it cost?
The cost for Refund Manager ranges from $6,000 on the low end to $30,000 on the high end with regards to the enterprise model.
Great, thank you, Tom. How much training is required?
The training for Refund Manager is very straightforward as part of the process, and Tom touched on this a little. We'll send you the training videos and the user guide, and the whole key is you don't have to memorize it, but as you saw the workflow today, it's really straightforward. Once we have Refund Manager installed in your test environment, and if you looked at those training materials, we'll have a Q&A call with you to answer any specific questions, walk through some refunds in your test environment, discuss any things in your workflow that you may need to adjust or improve to work with Refund Manager. So the whole process is very straightforward, and that's really kind of a testament to the workflow that Refund Manager provides you in getting these transactions created and information out to the accounting system and back end. So the training itself, again, most clients probably invest 90 minutes on their own, watching the video, looking through the user guide, and then again we'll do that call, and we'll do several calls if needed to help you get refunds processed the first time. After a time or two, you're ready to run on your own.
Great, thank you, Joe. Next question, will you be sending us out the slides to show us or for us to review later? Yeah, Tom, we can have you send out those slides to people who are interested, right?
Yes.
Okay, perfect. And it looks like this may be our last question at the moment. Is there also a monthly or yearly maintenance fee, or is it just, for example, the $6,000 all that we would need to pay?
There is an annual software maintenance fee as well that's associated with that, and then there is an installation and training configuration fee as well. The license fee and the installation and training fee are one-time fees, and then the annual maintenance fee is your only recurring fee.
Right, and as part of your annual maintenance, we keep it current with NextGen. As some of you may have noticed in the demonstration environment, we are running with UD3, which we support that in addition to several versions before, UD1, UD2. And we provide a help desk that you can call if you have any issues, or if you're having an upgrade to your accounting system and you need us to help you out with that and make sure the compatibility is still there with your accounting system. And of course, we're continuously rolling out new features. So a lot of the stuff we saw today is the product of many years of evolution and working with clients and them coming back to us and going, gosh, it would be great if it did this, or it would be great if it did that type of thing. And those typically make it into Refund Manager.
Great, thank you, Joe. Another question, can we get some references from other practices? Tom, I think that you can probably communicate directly with this question, and probably our case study would be a great start as well, if that works for you.
Correct. Correct.
Okay. Perfect, and yeah, we'd be happy to send those case studies to anybody as well. They're also available on our website, and any information really as far as references, additional pricing questions, all of that. Tom is going to be your go-to guy. He's really resourceful, and he's going to be happy to help you get answers to all your questions. Well, it looks like that's all the questions we have at the moment. But again, if any occur to you later, please feel free to reach out to Tom or Joe. Tom can reach out to you. And gentlemen, thank you both for presenting today, and thank you everybody for joining us. Thanks for taking time out of your afternoon to hear about Refund Manager.
Thank you, everyone. Have a great day.
Thank you very much. Have a good day.